Initially, when we moved down to Petersburg, we were exclusively diabetes management and education. But what we've started finding is that there was such a huge need to address some other issues too. So not only do we do diabetes education and management, we're also a primary care center. So we deal with a multitude of things. The metabolic syndrome, so anything that's connected to that, that's pretty much what we get here. And a lot of education. Pre-COVID, we were doing group classes around diabetes. We're a nationally recognized diabetes education center. The obesity here in Petersburg, the diabetic numbers here in Petersburg, the hypertension numbers here in Petersburg, renal failure is high here in Petersburg. All the comorbidities that exist with people of color are the highest here in Petersburg. So we really just sought out a place that was convenient for folks, especially for our elders. So we wanted to make sure that it was on a bus line, and that it was accessible for people, that it was accessible for folks who were handicapped. So we wanted to make sure it was a place that had a ramp, so this place where we are now has both of those, and that's what brought us to Petersburg. It's more than just, coming to work and working clinic for us. It's ministry for us. This has been a labor of love for a long time, and it's not for the faint of heart. Entrepreneurship is tough. It is so hard. But we did a lot of praying, and we know this is where we're supposed to be. Anytime we get discouraged and think we're not making a difference, a patient will call and say thank you, or we turn someone around, or something like that. So, but there is a huge need, and we perish for lack of knowledge. And part of why we're here is not only to heal on the clinical level, but we take a holistic approach to what we do. And we're also looking to do some online, have an online presence with our class, not just here, but throughout the state of Virginia, and actually have a national presence with our classes, because we understand it's not just in this sort of this pot of folks that we see physically here, but we've been getting calls for people who don't live in the state. Our tagline for our business is the missing piece of your diabetes plan, because there's a lot to managing some of these huge disease processes, whether it's diabetes or whether it's obesity. There are different pieces to it, and we really do pride ourselves in just being that missing piece. Let us support you, let us walk beside you, let us we want to be available. We liken it to a village, like Sean said before. We want this to be a place where people can come, they're comfortable, they are well represented, because representation matters. And we want people to feel like that they can open up to us, because that's really the only way that we're going to help them, if we have the information. We've been eating wrong for so long, so we don't really bring our patients in and say we're going to give you a diet. We like to use the term lifestyle change, because when we start telling people we're going to put them on a diet, the next thing they think about are restrictions. And we want them to be able to enjoy their food, but we don't want the food to kill them either. So we really try to individualize the plan for each person that comes in here. So when folks come to us with the obesity, we really want to engage them and let them know that this is going to be a journey. We are on the web, so they can just Google us, Case Management Associates, and we should pop right up. We're on Facebook. We have a Case Management Associates Facebook page. Or they can just give us a call right here at the office, 804-324-5051. Give us a call, ask us some questions, if we can help them. If they don't have a primary care provider, happy to help. This is a nurse-owned, nurse-driven practice. So, and we pride ourselves in that. We're just here to heal the village. We always tell our patients, we want to make sure that they become the CEOs of their healthcare. So we say that all the time, because as it's journeyed through the years, a lot of people have put that role onto their provider, that they are the lead of their healthcare, and it's not true. The patient is the center, and the providers surround the patient in their healthcare. But so we're trying to re-emphasize that you're running the show. This is the only vessel that you have. And we want to make sure that you take care of your vessel. And that's what all these surrounding people are here to help you do. And that's what we're here to help you do, to make sure that you're the best version of yourself that you can be. And that's our job. That's our calling.